Hi everyone. So today we were very lucky to have Dr. Dorothy Joe with us, who's one of our consultant neurologists who specialises in advising people with brain tumours on looking after their symptoms. So we're going to talk to her today about seizures and run through a few questions that we get asked often as the nursing team and we go to the doctors for support for. So Dr. Joe, what are seizures?
So a seizure is when you get a sudden burst of electrical activity in your brain, and that could cause a loss of function or uncontrolled movements of your body. And so when you get more than one seizure, you're then diagnosed with epilepsy. And that means that you're more likely to get seizures compared to somebody who doesn't have a diagnosis of epilepsy.
Okay, and if somebody has a brain tumour, what might we expect when we think about seizures with somebody with a brain tumour?
The seizure, the kind of seizures that they get are actually very similar to people who have just epilepsy without brain tumours. And broadly, there are two types of seizures. So firstly, there are the generalised one, which affect both sides of your body. And it can be quite daunting if it's the first time you've seen one, and people usually will collapse, they're unconscious, there'll be uncontrolled jerking of their body, of their limbs. And sometimes there might be frothing of the mouth, they might bite their tongue, or they might even be incontinent. And there are also focal seizures, which only affect one part of the body. And these usually are milder. So people may say they have a weird sensation on one part of their body, or just a localized part of their body being twitchy. But there are also times when people just look confused or dazed, and with unusual repetitive movements.
So if a person has a brain tumour, are they always going to have a seizure?
So brain tumour is a common cause of seizures, but not everybody develops seizures who have brain tumours. So broadly speaking, we say as many as 60% of patients will develop seizures if they have a brain tumour. And this could either be the very first symptom that they get, or it could be later in the course of their disease.
Okay, so if I have a seizure and I have a brain tumour, what's the best thing to do? What can I do? Because it does sound a bit scary, and some, understandably, people do feel worried when they have seizures. So what could we do to help? If I was the person having the brain tumour, what advice could you give?
There are certainly things that you can do. I think we can broadly divide it into three categories. So firstly, treatment. So anti-epileptic medications are given to people who, with seizures, who we hope to reduce the chance of their seizure recurrence. And there are many different types of medications available. And it's therefore very important that you stay compliant and take the medications as prescribed. And if you develop side effects from them, do let your nurses or your GP know, or even your neurologist know, so that we can try different types of medications for you. Secondly, there are lifestyle advice that we usually give. For example, there are certain triggers or factors that we know make people more prone to seizures. They can be not getting enough sleep, they can feel stressed, alcohol or recreational drug use, or sometimes when you're particularly unwell, so for example, having a very bad infection. And as I said, these are potential triggers to seizures, but not everybody experience them. But if you're able to identify yours and you recognize them, it'll be good to try to avoid them if possible. And the other thing also to say that is very common for people to feel upset or even frustrated with the diagnosis of seizures. And so if that's how you feel, do let your nurses or GP know, so that you can be signposted to the available psychological support. And lastly, we say about general safety advice. So for instance, we normally advise patients to take showers rather than baths, and try to avoid open fire. For example, when you're out, just take extra precautions, so you step a little further away from the edge of the curb or the train platforms. And lastly, there may need to be some work adjustments depending on the nature of your work. So for example, if you work at unprotected heights, or if you work with heavy machinery.
And a question that we're often asked is, if you're a caregiver for somebody that has a brain tumour, one of the questions that lots of people worry about is, can they leave their loved one alone? And that's quite a difficult question to answer. And could you talk us a little bit about that?
Yeah, I think it is hard. I think it's particularly difficult in the initial stages when you may not be as certain of how your disease course plans out. And as I said before, it could be quite daunting seeing somebody having a seizure. So the main thing I would say is general first aid advice if you're in that situation. So for example, you can try to reassure them if they're having the milder, smaller seizures, because some people can be quite confused or agitated. And really the important thing is try and stay calm in these situations. If you're having, if your relative or your friend is having those bigger ones, the generalized ones, then we usually say let them run its course. People usually will have seizures terminate on their own within a few minutes, less than 5 minutes. And it's important to try to guide them away from obvious danger. So for example, if it's close to a radiator, a hot radiator, or open fire.